Dr. Mike Bartuszki from Terra Dental Care, and today we have a patient, Erin, that's coming in to see us for a checkup, and she's got a couple questions about some of the wear on her teeth, and also she knows that she needs a couple crowns. Prior to her coming in, what I want to do is I want to go to my computer software, AuraQ. AuraQ is an AI software that helps to bring all of her data into one place so that I can easily take a look and review the patient's overall health, all their dental risks, outstanding treatment, and so it gives me a good view to be able to see everything that's going on with Erin, so when she comes in, I'm prepared for her. So right now I'm going to take a look at AuraQ, and I can see Erin's demographic information, her some information on her preferences, personal notes and information about her and things that she likes to do. We have her medical history, her medications, and all of those key things that are important as a dentist when we're working with our patients. And then I have all of the risk categories in the AuraQ software. I can look at her medical risk. I can look at, does she have any risk of sleep apnea? Also the biomechanical and occlusion risks. And we notice, like for example, on the occlusion risks, she is a little bit high on the occlusion risk because she has some wear. She does report jaw pain and clenching grinding, and she has some recession on some teeth. And then I'm also able to take a look at some of her imaging. And so when I take a look at her images, for example, one of our key images here is she does have heavy wear on the right-hand side, and we can take a look, and that also shows up on her upper. So there we can see that clenching grinding, so that's important for us to assess. And then we do, again, we have a crown that has been leaking and she's due to have that replaced. One of those reasons may be because of that extra force that she's putting on that area. So we're going to talk to her about some of the different things that we see in her wear and tear, the cracking on this root, cracking on this tooth, as well as I mentioned, about possibly replacing that crown. So as you can see, I have Erin's risk categories up in patient-friendly terms so that she can understand which areas she's more at risk for. If I click on those areas, I can get the same insights recommendations in patient terms so that she can understand those better. I can also then take a look at photos, x-rays, and be able to bring those up in front. Hey Erin, how are you doing today?
Good, thank you.
Good. So I know you wanted to come in to talk a little bit about the teeth that you had planned for crowns. I know you've been clenching, grinding, the jaw's been sore, and you've been getting Botox for that. But I wanted to kind of go through from our software AuraQ. It kind of brings all of your data together so that we can have everything in one place, but also it highlights your risks. So it gives us an idea of how important is it to do treatment now versus waiting for the future, and what are the potential risks of waiting into the future, which could be like a broken tooth or something like that. Really, it's the bite and the bite issues and the risk of the cracks that has been focusing us more on why to do the crowns. So when I take a look at your biomechanical risk, you can see that we've got the 4-6 is planned for a crown. We're also considering the 3-6 for a crown where there is some cracking. So another thing we should probably do is also kind of assess, with your bite, can we adjust your bite or level out your bite a little bit so that it feels more balanced to you? So that's something that we can assess. So bringing this all together, it gives us a great idea of what's best to get done on you right now. Does that make sense to you?
Yeah, totally.
Yeah. So should we just go ahead and get that crown booked?
Yeah, that'd be good.